Welcome back to Coastal Living. Please welcome Dr. Dennis Van Maren with Bay Area Denture and Dental Center, here to talk about mini dental implants. Thank you so much for joining us,
Thanks
Doctor.
for having me.
All right, so tell us a little bit about how long you've been in your practice and what you do specifically.
I was actually in the military after dental school for about 21 years.
Oh, well, thank you for your service.
Retired back in 2012.
Okay.
And then I moved here and I bought the practice that I'm in right now. I've been in there since then, so about 7-8 years. And we do all kinds of dentistry. I'm a general dentist, so we do everything there. We concentrate pretty much on just oral surgery, on implants, and on dentures. But we do everything.
Wonderful. And I know today's topic is primarily focusing on mini dental implants.
Yes.
And whenever you hear that, it doesn't sound as intimidating as what you're anticipating in your head. So tell us a little bit about that.
Yeah. The mini dental implants, you know, they the implants themselves, this type of implant was developed about 50 years ago.
Okay.
And they started with the bigger conventional implants. And then about 20 years ago, they developed the mini dental implant as we know it today, okay? And they're really about the same type of thing. They're both made of the same material. They're made of titanium. They're about basically the same shape. The big difference is that the mini dental implants are smaller in diameter, okay? So it's anything below 3 millimeters, and they work out in a lot of different situations.
Wonderful. And what are they used for exactly? I see that you have some props here, which are showing.
I use them, they have many uses, but I use them basically for two different kinds of things, okay? One is for dentures, okay? And say somebody has like a loose denture, okay, and they want to have it fixed down to where it doesn't move around and it gives them more chewing force and everything. I can place these implants. There's two types that I use that basically differ by the attachments. This is the first one right here, and I can place anywhere from 2 to 4 implants in there. And then we put little housings in the denture itself, okay,
wow,
that snap onto those implants. And then so you can snap it on, you can almost hear it. Okay, I don't know if they heard that, but
I heard it. I certainly heard it.
But it's in there. I mean, it does not move around, okay? So they can chew just about anything they want with that, okay? Now, the second thing that I use it for, or second type of denture, is what we call a hybrid denture, okay? And I use the different kind of implant for that. It's got a different attachment on the top, okay? And I'll place about 6 implants on the top and 6 implants on the lower. And then we make what's called a hybrid denture, which has metal type substructure to it, then with the denture teeth on top, okay? And it has the little snaps built into it. And those will snap right onto the implants. The patient does not take these out at home. They just brush their teeth, clean it real good. Then when they come in for their cleanings about every 6 months, I will take it out, and then my hygienist will clean up the implants, clean up the denture. We snap it back in, and then they go back home, and we don't see them again for 6 months.
Okay.
The third type that I use, okay, is what we call a fixed type denture, okay? And what that is I use these same type of implants, but I'll put 10 implants on the top and 10 implants on the bottom. Then we have the same kind of hybrid denture, okay? But it has little holes built into it that fit over the implants, and I cement that onto the implants, okay? This does not come in and out. This is fixed in there, okay? So the patient just cleans it at home, brushes it. He'll come in for their checkups every 6 months. And this is about as close as you can get to giving them their real teeth back again.
I see.
Then the last thing that I use it for, okay, is for like implant crowns and implant bridges, okay?
Sure.
For an implant crown, say somebody's missing a single tooth here, okay? I'll put an implant in that space, and then we make a crown that cements onto that implant, and the patient has their tooth back again.
Oh my goodness.
We can do that for multiple teeth. I'll place as many implants as needed for the space. Okay. We make a bridge that cements onto those implants, and you cement it on there, and the patient has their teeth
It
back.
looks like it's easy as 1, 2, 3, I have to say.
Oh, it's very easy, very easy.
Well, thank you for bringing these props. I
Oh,
know we
absolutely.
do have some before and after pictures that we do want to show you here. Take a look at this. This is absolutely incredible. Before and after, his teeth look beautiful.
Yeah, this was a full mouth rehab case that I
Okay.
did. Yeah, yeah, we got a really good result. This patient, she was missing 2 of her lateral teeth. We put in those single implants like that and made some crowns, and she has her smile back.
I'm jealous. I wish my teeth looked as beautiful as hers do. That looks absolutely great, I have to
Yeah.
say. And let's talk about this.
This was one of our denture patients. She had some really advanced periodontal disease, so we had to give her some dentures.
Okay.
And then we used some implants to snap those dentures in place. And we got a really good result with that too. It's
I could see
like
that.
night and day there, yeah.
Oh, yes, sir. And I have to ask you, how do you know if you're a candidate to get these implants?
Just about everybody's a candidate. With the bigger conventional implants, you know, you got to have a certain amount of bone and everything, but with the mini implants, you can use them, and even if they have thin bone, they're smaller diameter, so they'll still fit in there, and it allows people who wouldn't normally be able to get implants, now they can get them.
Right, and you know, for the people that are watching and that have interest in doing something like this, they might assume that it's painful. Is it kind
Absolutely not.
Not at all.
No, not
Okay.
at all. You know, the conventional implants, they have to make an incision, lay the tissue back, make a big hole in the bones, you know, close up the tissue, let it heal for 4 to 6 months. It takes a long time. With the mini implants, all I do is I make a small little pinhole through the tissue. I place the implant right through that pinhole. It engages in the bone, it's tight right away, and we can put the crown or the dentures on right away. I'd say about 99% of my patients, after I get done, they said they had no pain at all with it.
Well, that's
And
great.
there's really no recovery period either.
That's
so.
wonderful, and it's comforting to know that. And let's go over your denture wearers package that we have here.
Okay, so that's somebody who has teeth and they need to have them out and have dentures, okay? So this package, it includes the immediate dentures, which is basically the dentures that go in the mouth right when we take the teeth out, okay? It includes all the extractions, all the follow-up care, the adjustments, all the relines during the healing period, which lasts about 6 months. And then it includes the second or permanent set of dentures at 6 months also, okay? And we
Wonderful.
realize that this is a big cost for a lot of people. So
Absolutely.
we've given them discounted prices for the extractions, and then the immediate dentures are only $150 an arch. I mean, that's as cheap as you're going to find dentures anywhere. And really, it's just designed to help the patient out.
Talk about a package. That is a great deal, and you can see the information on your screen. I hope you're taking notes. 361-857-6200. Doctor, thank you so much for being
Thank you
here
for
today.
having
You're
me.
very informative.
Thank
for
you
your
very
time.
much.
All right, well, coming up next, we're talking nerdy with Johnny. Find out what topics we're covering when we return on Coastal Living.